Well, good evening everyone. Welcome on behalf of the Council of Governors to the Northamptonshire Healthcare NHS Foundation Trust Annual General Meeting and Annual Public Members Meeting. My name is Chris Davison. I'm a Public Governor for the constituency of Kettering and Corby, and I'm also pleased to be the lead Governor for the Trust. As our Chair and Chief Executive have already referred to, this has been an unprecedented year as we look back over the pandemic. And on behalf of the Council, I would like to extend our sincere thanks to the staff and teams from every corner of the Trust who heroically have supported the work of the NHS and have come alongside the nation at its time of need. You might be thinking, what does a Council of Governors do? What do governors do? Well, we are elected by members, we are volunteers, and we represent service users, patients, carers, partner organisations, staff, together with the public. We have two statutory duties and a range of functions as a council. I like to describe them as the two sides of the same coin. One is that we hold the non-executive directors to account, both individually and collectively, for the performance of the board. And on the other side of the coin, we represent the interests of members and members of the public. So to that extent, we have one foot in the Trust and we have one foot in the community. Further details of the work of the governors and the council can be found on pages 85 to 89 of the annual report and accounts. However, that might be a little bit dry, and I'd like to bring this to life by giving some little extracts from my fellow colleague governors about what's important to them. What are their motivations at becoming a governor?
My name is Lloyd Cox and I'm an adult service user governor. I became a governor because as an ex-inpatient, I want to help fellow service users. I want to be a voice for the people in the service, and from past experience of being on medication and being restrained and dealing with equality and inclusion, I want to challenge and be a voice in the here and now.
Hiya, my name's Susan and I'm a governor for the NHFT Northampton. I became a governor because of my vast lived experience within mental ill health. I live with mental ill health. The most important part of being the governor for me is making big changes for the system, making it better for people to live a much fulfilling life in the community. For me, membership, representation is important to me. Engagement is important to me because engagement is important as in it makes action, keeps people well. Representation, I like representing the community in the way that I will follow my heart and do what I believe is right for the community.
Hello, I'm Tracy LaPenna and Staff Governor for Nursing. I work within the Trust as a health visitor and supervision lead. The most important part of being a governor for me is having the ability to influence positive change. Being a governor gives me a voice for my profession and allows me to display the Trust values and behaviours, including being authentic and working together.
Hello, my name is Vida Enser and I'm your Public Governor for Wellingborough and East Northamptonshire. Having worked for many years in the health field, I really wanted to continue to contribute by working with the public in representing and shaping services into our community, and the best way of doing that I felt was by taking on this governor role.
Good afternoon. We become governors for many and varied reasons. Our motivations differ. For me, it was the opportunity to represent public, the community, and to support community-based initiatives such as the Health and Wellbeing Information Hub that we have set up here in Kettering High Street. We all want to make a difference and add value and strengthen our communities. And as governors, we have the opportunity to do so in the unique role that we have. Thank you. As you can see, our reasons and motivations for becoming a governor are many and varied. We are volunteers, so we give of ourselves, we give our time and our energy in order to support the work of the Trust for the benefit not just of our communities, but also for the Trust. And to that extent, we need to act like patients, but think like taxpayers. At the start of the pandemic, we agreed as a council to adopt 3 principles to shape our work during the pandemic. 1, how do we transact business? 2, how do we communicate? And 3, how do we support each other? We have seen introduced a range of new meetings over and above our formal council meetings, keep in touch briefings, workshops, specific themed areas to look at to keep us informed and up to date on not just our work but our role. I would like to share with you 3 specific initiatives that we have been involved in during the course of the year. Back in January, we had an event called Blue Monday, which historically is a day in mid-January where certain things and events collide, which is triggered with issues around low mood. We were pleased to put on a members event that promoted prevention, early intervention and signposting, both to NHFT services, but also to services that are available locally to support your emotional and mental well-being. And I'm pleased and would like to acknowledge the help of our colleague Dr. David Smart, a local GP, who helped with that presentation. Secondly, as a council, we were actively involved in the Reforming Mental Health Act consultation process. The government published a white paper on the future provision of mental health in the Mental Health Act. And a unique offer that we provided as a council was that our carer governors, who speak from a position of lived experience, were able to comment on the proposals as part of that consultation process. And finally, as we begin to enter a new normal, as society resets, we have seen the opportunity for us as governors to be involved in health and wellbeing festivals, one in Kettering, one in Wellingborough, and other public-facing community engagement events, where clearly we are also able to promote that prevention, promote early intervention, and also to signpost members and members of the public to the services they need. The theme of this year's annual public members meeting in AGM has been looking after ourselves and looking after each other. If we are to respond effectively to the challenges we face as a nation, as a society and a community, then we need to find ways of working together. In the year ahead, we will, as a council, be looking to take a bit more detail and analysis in our holding to account role around indicators covering patient safety, patient experience, clinical quality of care, as well as operational standards and finance. We are beginning to enter a new phase around integrated care systems. What is the role of a governor in system working? And where is the voice of the public within those plan changes that the government are proposing? But what we will do is that we will continue to represent you. We may not do it well, we may not get it right every time, but we are here to provide a voice for those that don't have a voice, and we will do it to the best of our ability. Thank you.